Good evening, everyone, and welcome to VT Reach, which stands for Virtual Teleconference, Reach, Explore, and Aspire to Careers in Healthcare. And tonight's session, we are spotlighting careers in dentistry.
We are really excited to have tonight with us Dr. Nguyen, Dr. Yasewicz, and Dr. Gaughan, and we will let them take it away, starting with Dr. Nguyen and her inspiration into dentistry.
Hello, my name is Olivia Nguyen. I'm currently a dental resident at the UVM GPR residency program. So my inspiration to dentistry was a pretty non-traditional route. I did complete my bachelor's degree at UVM in 2011. I majored in biology, minored in business, and after college, I wasn't sure exactly what I wanted to get into. I was kind of interested in public health, biopharmaceuticals. So my first job after college was actually a research position at the Forsyth Institute of Oral Health Sciences. It was there I worked as a research assistant for actually 6 years. In that, during my time there, a lot of the research we did revolved around in vivo and vitro studies investigating molecular mechanisms and resolution pathways of inflammation in patients with periodontal diseases. A lot of my PIs were periodontists that were really well known in their field. So they attracted a lot of clinicians, researchers, residents, students to pursue research in our lab. So it was there I was really interested in learning a lot of lab work, hand skills, animal work, and what it takes from learning what our patients needed in chairside, and then translating that to research, and then translating that into therapeutics. So that was my first time meeting dentists who did it all, who did the research, the clinical care, academia, and business. So talking to them and learning about the dental field really inspired me to pursue dentistry. So I was there for 6 years, and I applied to dental school after, but because I had been out of school for a while, a lot of the admissions recommended I pursue a master's. So I decided to pursue my master's at BU. I got a master's in oral health sciences, which is a 1-year program that is actually very tailored for people who want to get into dental school. And it was a great program because we actually got to take science courses with the dental students in their first year. And so it was really great exposure to see if we were interested in dentistry before really committing into dental school. So after that master's program, I got into BU for dental school, was there for 4 years, and then now I'm at the UVM GPR residency, which is most students either, I felt like they used to go straight into the professional of working right after school. But I find that more dental students are finding a GPR or AGD residency, which is a 1-year general dentistry exposure for the clinic, and also exposure to hospital work before applying for jobs. I felt like it would have strengthened my application into pursuing job applications, and also just building more confidence in my clinical skills under mentorship. So the responsibilities generally that general dentists have, we do periodic exams, which mostly everyone gets as a patient. They're usually during dental hygiene appointments, usually after the cleanings, to check for any caries or restorations that are needed. We complete composite restorations, also known as fillings, crowns, root canals, removal prosthesis, which involves complete and partial dentures, extractions, implants, periodontal surgeries, and specifically in this residency, we've been able to do a lot of on-call for the hospital. And some dentists also are on call in their own hospitals. Dentists can also complete Invisalign, facial injectables, treat TMJ disorders, and sleep medicine. So I'm currently at the UVM Dental Clinic rotation. The UVM GPR program is kind of split into 3 rotations. We are 3 months in the hospital, 6 months total at the Dental UVM clinic, and then 3 months in a rural community healthcare center in Plainfield. So I'm currently at the UVM Dental Clinic rotation, which typically is a Monday through Friday, 8 to 5 p.m. It most resembles to the type of jobs that we will pursue after residency. Normally the day starts with morning rounds going through the schedule. The last patient is usually ends around 4 p.m. and then we'll stay to finish notes, lab work, review patients for the next day. At the UVM Dental Clinic, we work with dental assistants and EFTAs. With dental assistants, it's great because it's four-handed dentistry versus in dental school, we normally are kind of working by ourselves. So this residency also was great for us to learn how to work with a dental assistant, increase our skills, and also working with EFTAs who are trained to do reversible dental work. So that can include completing temporary crowns and fillings. And then outside of dentistry, I enjoy the outdoors. Being here in Vermont has been really nice transition from being in a city like Boston. Access to hiking, swimming, biking has been great. I like to do hot yoga. Actually at UVM, I used to dance in our Cases Dance Company, which is known for their contemporary dance. It's student run. And I actually continue to dance with some of the Cases alumni girls who actually still live in Burlington. So it's been fun to be back here. I also like to try out new restaurants, love to knit, and spend time with friends.
Thank you so much. And before we move on to Dr. Yasewicz, I just want to remind students that if you have any questions, to please put them in the chat and we will address them during our Q&A session. But now we will hear from Dr. Yasewicz and her inspiration into dentistry.
Hi, I'm Grace. So I was one of those people when I was like in 3rd grade, I was like, I want to be a dentist. And I think it was just because I went through ortho early on and I had a really positive experience with the dentist. And then as I got older, I really identified that I love science. I went to UVM, I studied microbiology, and I had a minor in global health. And so at that point, I kind of knew I wanted to go into healthcare, but I wasn't comfortable completely limiting myself to just considering dentistry because I had just identified that when I was in 3rd grade. So I thought, well, why don't I shadow? So I shadowed PAs and physicians and dentists, and I ultimately decided to go to dental school because I really liked the relationship building part of dentistry. As a general dentist specifically, we see our patients for, decades if you work in a family practice, for example. And so you really get to know your patients. And I really liked that part. I'm a big people person. So to me, that was really attractive. And then I also just really liked the fact that when a patient comes to the dentist, comes to see us, a lot of times they're in pain, they're uncomfortable, there's something going on. And we have this really specified skill set that can take someone out of pain that day. So we do a lot less management of like chronic diseases and a lot more like direct surgical approaches, which I think is a really cool aspect. And we get to work with our hands and we're very procedural based. So I really liked that. And I also really liked that I know it's like patients come to us really anxious because the dentist has a really bad rap and it's really uncomfortable. It's a really vulnerable position for a patient to be in. And a big part of our job is working with our patients to kind of achieve a new view of dentistry and give them a good experience and really build that mutual trust with them. And I really, really liked that part of dentistry. And so that's kind of why I ultimately decided to pursue dentistry. So I went to UVM, like I said, I had a BS in microbiology, and I studied global health, which I really enjoyed through the anthropology department. And then I did take a gap year and I worked as an ophthalmic technician at a practice in South Burlington, which was a great year for me because it was the first time I had a lot of like direct patient care experience. So I think I really grew in my ability to speak to patients and just like take a basic medical history and stuff like that. So I really valued that year. And then I got my DMD at the University of New England in Portland, Maine, which I really loved. And now I'm also doing the 1-year GPR at UVM. So Olivia did a really nice job covering like what we do when we're providing comprehensive care to our patients. So I won't cover that again, but I am right now the hospital resident. So I can kind of touch on what hospital dentistry looks like. At UVM, we are a little bit limited as far as what procedures we can do in the hospital, but there are hospitals in the US that have dental clinics. So that would be like seeing inpatients and doing dental procedures while they're inpatient. At UVM, we do we're a consulting service. So we get a lot of calls for inpatients that might be experiencing dental pain, dental swelling, but other things too, like if they're starting certain medications that can affect the bone in their mouth, they'll ask us to come look and do an evaluation, or if they're getting cleared for some sort of valve replacement and they need dental clearance, we also consult for that. And then we also cover dental emergencies in the emergency department. So we drain abscesses, chairside, we splint teeth after traumas, and then we also work with oral surgeons in the operating room for different cases, like certain extractions that need to be done under general anesthesia, but also larger cases like orthognathic surgeries where they're repositioning either the maxilla or the mandible, or sometimes both. And so you kind of get a little bit of everything and kind of see all sides of the hospital, including the OR, which is really awesome. So work-life integration, like Olivia said, dentistry tends to be like an 8 to 5, 4 to 5 days a week. But it also, one of the things about dentistry is that, especially in our state, it's in Vermont, it's a lot of dentistry still practice in like small private practices. So you do have a lot of autonomy with your schedule. So it's hard to really pin that down just by talking to a few people's experience. But some dentists work 5 days a week and work some Saturdays, some work 4. So it just really depends on what your setup is. And then for us, we during this year take on call for the hospital. So we are on call. We do 24/7, 365 coverage between the four residents. So we do work nights on call and also weekends during residency. And then when I'm not doing dentistry stuff, I really enjoy skiing. I like to read, and I really like eating good food.
Thank you. And now we will move on to Dr. Gaughan and her inspiration into dentistry.
Okay, sorry about that. We have a fairly newborn baby here, so I was trying to feed her and make her quiet, but no guarantees she might start squawking. Okay, inspiration into dentistry. Okay, so I had a little bit of an alternative path to dentistry. I was actually an art major. Let me start. I'm an endodontist in Vermont. I've been practicing here for about 5 years. So as an endodontist, our specialty is doing root canals and other procedures that can retain a compromised tooth. So how did I get into that field? I know it sounds perhaps like a strange thing to get into, to specialize in. I was an art major in college, so I loved anything to do with art, drawing, painting. I loved working with my hands, and that was my main reason that I was interested in the arts. After working in the arts for a while, I realized that I'm not really that creative of a person. It was more like the interest in working with my hands that made me get into the arts in the first place. So after I worked in the arts for a little bit, I realized that I'd always had an interest in medicine. And I finally, during a dental appointment, I realized I put 2 and 2 together. This would be a perfect field for me. All my friends and family thought I was crazy because I was an art major. I obviously had a lot to do before I could actually apply to dental school. So I decided my first step would be that I would become a dental assistant. And so I did that and I enjoyed it. So I got a lot of experience that way. I proved to myself that I enjoyed it. And then I applied to a postbac to get the science requirements, which I needed to get. So for that, I went to Bryn Mawr College, and I did a postbac for 1 year. I got all the prereqs in, applied to dental school, and went to University of Pennsylvania for that, and also did my residency there in endodontics. So that's 2 years after dental school. And then, am I able to advance these slides, or is somebody doing this for us? What's next?
I am taking care of the slides. But
Okay,
if you
great.
need to go next, just say next.
Wonderful. Okay, so an endodontist, what do we do? Like I said, we do procedures like root canals that allow people to retain a compromised tooth. So generally, mainly that is a root canal. There are other procedures that we can do. There are surgical procedures like an apicoectomy is a surgery. If a root canal fails, we can do a surgery at the end of the root. And also there are other surgeries, like we can actually reimplant teeth. So we can take a tooth out, do a surgery on it, and put it back in the jaw and have that heal. And then there's vital pulp therapies we can do on children who have immature teeth that allow them to continue developing that tooth. And the other thing about endodontics, which is one of the reasons I went into it, is there's a lot of flexibility. Not all endodontists work 5 days a week or even 4. I actually work 3, and I like that. And I also don't own a practice. I go to different places where I can do root canals on the patients at that general office. So that was one of the things that appealed to me, because I knew that maybe management wasn't something that I was interested in doing. So in this specialty, you don't necessarily have to own a practice. Okay. Like I said, I work at different locations, 3 or 4 days a week. And just, it changes depending on where there's work to be done. And in Vermont, there's no shortage of that. And I do like to have a good work-life balance. Like I said, I have a newborn, so I am quite harried right now. We have the newborn, we have a 5-year-old and a 1.5-year-old. And that is my dog Meatball. He had a rough week last week because it was his birthday, and he had 13 teeth extracted, but don't worry, they have like 42 teeth. So he's still okay. He can still eat. And yeah, I like to cook. I like to be outside. I like all the stuff Vermont has to offer. So I love being here. Yeah, and I love being an endodontist in Vermont. It's great.
Well, thank you so much. And so we will start to begin taking questions from the chat. But before we started, I was hoping you could explain, and this is for any of you, what the 4 years of dental school look like and what the entry exam looks like as well.
So a general overview. So basically the first 2 years of dental school is like your basic medical sciences. So you'll cover, and in fact, it's like medical school the first 2 years. In fact, some dental schools like UConn, I don't know about UPenn, but I know like UConn, Harvard, McGill in Canada, they actually just do their first 2 years with the medical students. And then in your third year, end of your second year, third year, they'll move you into like simulation clinic. So a lot of the procedures, not all of them that we do, you first learn on plastic teeth in a lab setting, and you have, exams on the plastic teeth, and you get a lot of feedback. And so that's really to start developing your hand skills. And then your third and fourth year, they'll move you, depending on the school, into a clinic setting. And so something that's a little bit different between medical and dental school, for example, I'm using medical school as just the most well-known example, is that dental schools all have to have their own clinic associated with the school that is staffed mostly by students. And then if there's specialty residencies, by the residents as well. And some schools also have a faculty practice. And so as a student in your third year and fourth year, you help staff doing general dentistry in the school clinic. And then that's when you really start developing hand skills and patient interaction. And then the entrance exam is called the DAT. I think it just stands for dental admission, something, I don't know. It's been a long time, but it's also similar to the MCAT. It's covers basic sciences. And then there's also like a perceptual ability section that's a little bit different. It's like these like mind puzzles essentially. And they say it's to help kind of like assess your spatial awareness which like helps determine your dexterity. I don't know if that's necessarily true, but it's on there. So it's definitely, that part's a little bit different.
Yeah, and just to reiterate what Grace mentioned, the fun thing about dental school in your third year, after that first year is didactics, then the second year you actually learn dentistry. So you'll learn the techniques of fix, prosthesis, removable, endo, etc. And then we get to apply those skills and theories in the simulation lab. And from there, in third year, you are the provider. So you have your patients, you schedule them, you treat them, and you do refer to faculty who mentor you. So third and fourth year, you're acting like a dentist.
Well, thank you. We have a question in the chat asking about, an undergraduate degree that is kind of best to potentially major in before dentistry school. And for those who stated they were more non-traditional, do you feel like your original major or studies kind of helped in your current dentistry practice? And then also just a follow-up that I'm wondering myself is what the pre-dental requisite classes are, and if they're the same as like pre-medical or pre-PA type. Sorry, that was a long-winded question, but
I'll answer that. I really felt that my art major was really beneficial to dentistry. Fine-tuning those hand skills as an artist really I felt sort of really prepared for a lot of the things you have to do in dental school. As far as the lab is concerned, did I feel prepared for the science part of it? No, I did not. I did have to do the post-bac and that helped a lot. So I do think the other thing that's beneficial about that non-traditional degree is that you get a little attention on your application. So I don't know that there is a good or best major. I think that if you set yourself apart in your application, maybe a non-traditional degree is a good thing. For me, I think it was. And one of my dental school instructors said that the best major for dental school was theater, because he thought that all dentists have to kind of be able to present things to patients in a certain way. And almost it is kind of theater in a way.
Yeah, I would say if you have an idea you want to pursue medical or dental, I think doing a biology major. So I declared a biology major because I was actually originally undecided going into college, but I wanted to take a biology class. So by default, they were like, just be a biology major. So I was like, okay. And then I just continued with it. And so I guess prereqs, it's really similar to medical school. So bio, orgo, chem, biochem, I forget, but basically each school will list the prereq courses you need to take. So it is convenient to take those courses, but that is if you decide not to do a post-bac, it could be a really fun opportunity to major in something else, like Dr. Gaughan mentioned.
Yeah, my comment on that is always like, study what you want to study in undergrad. Like I never felt like, I really liked physics is one, which like a lot of the science majors don't cover anyway. But anyway, a lot of the health, like the life science majors. But my comment about this is like always, undergrad shouldn't be like necessarily, the only reason you're going to undergrad isn't like just to like set you up to go to like dental school or whatever. Like you should definitely study what you want to study in undergrad and feel like fulfilled in that as well. And as Dr. Gaughan was saying, like that's still gonna apply, like you're gonna like gain skills from any major that's gonna apply in your life or in dentistry or whatever it may be. So it's, I think, also important to study something that you want to study, because undergrad's also a financial investment in itself. So you want to make sure that you feel like you're taking something away from it that like fulfills you. But the general science requirements you can like achieve while you're studying something else, because it means biology, like, I don't know, B Core 11 and 12. I don't know if that's still the course titles at UVM. and then like Gen Chem, 2 semesters of Gen Chem, 2 semesters of Orgo, and physics. And then there's also, you always have to pay attention, like at the time I was applying, like no other school other than UNE required anatomy and physiology. And so I hadn't taken it at UVM, and I had to take it in my gap year because I really wanted to go to UNE. So there are like sometimes certain schools have little random classes that don't really necessarily fit into like the umbrella classes. So just like also when if you're applying, make sure you're paying attention to those as well.
Thank you. And then another question for the chat, from the chat saying, besides shadowing, what other ways would you recommend getting exposure to the field as an undergrad? And just to kind of piggyback off of that, are there things you can do as an undergrad student, like clubs, organizations that would help you in a dentistry journey?
When I was an undergrad, I worked as a sterilization assistant at a dental practice. So you could dental assist. That's kind of hard though. A lot of times practices are looking for like full-time dental assistants, and you might not have the time to do that. But that would be a great way to get exposure. And there are people that definitely do that. I was a sterilization assistant, so I did all the sterilization for a practice in the summer, one summer, which still I think a good experience. It wasn't as glamorous, but I got to really like see how offices work and kind of what everything was all about, and just like make relationships with hygienists and dentists, which I thought was really great, and just ask them questions. And then other things you can do like an undergrad, I did research, like bench research, which I think is definitely looked like, it's not like a necessity, but it's definitely looked on favorably. And then I also just, again, would always say like do stuff that you like doing. So I really liked like mentorship. So I was a TA for multiple different courses, and was involved in like a mentor. I don't remember what it was called. It was like the first year, it was like a mentorship program that went to like Winooski's schools, and we did like little science lessons with the students. And I like really enjoyed doing that stuff. So I think if there's any like enrichment activity that in an interview you can like genuinely talk about, that it was important to you and that you really enjoyed it, and this is like what you learned from it, dentistry aside, like this is how it made me a better person, I think that's like looked on favorably from like an admissions standpoint, in my opinion. That's an opinion. I'm not on an admissions committee, just for the but I think like you can like build your CV around things that you like genuinely like doing and you feel like you're gaining something from.
Yeah, I agree with Grace. In undergrad, it was before I realized I wanted to go into dentistry, but the types of clubs I was in kind of ranged. I did the dance company, but I also did the Water Tower News. So that was fun because I took a lot of science-y courses, and I tried to mix that in with anthro and business and art classes, but I felt like writing was kind of my weakness. So that was a very low pressured way to practice my writing skills and drawing skills, because we got to draw our own cartoons for the newspaper. But I reiterate what Grace said. I feel like if there's something that you like to do in the summer that is like coaching or working in a restaurant or volunteering anything with dentistry, I think that's important. I honestly think customer service, any form of work in customer service, will help you talk to patients, because a lot of times you are educating patients on how to care for their oral health, and you're also kind of a therapist in a way. And you also have to face a lot of rejection. So I feel like I start a lot of appointments sometimes saying, oh, I hate the dentist, or I don't like the dentist, or my parents hate the dentist, so now I hate the dentist. So you kind of have to, sometimes I feel like I have to reshape this person's mind about dentistry. So a lot of it is talking to people and being approachable. And I feel like working customer service helped me a lot. I worked in a restaurant for a really long time. So working on a team, being able to serve people, talk to them, and just kind of growing your communication skills. I think that's really important. And I do remember one of the deans at BU, I remember he mentioned he did like students who played sports. This is just this one person. You don't have to be on, you don't have to be in a D1 team, but he felt that those student athletes knew how to juggle. So I think just kind of doing what you like, play what you like, and I think just like have fun in college. I think that speaks a lot more in interviews.
All right. Well, thank you. I think it's, very important to share, unique or various experiences that students can have. I had a question for all of you. I guess I was wondering what is an aspect of dentistry that a lot of people might not know, or that maybe you didn't know before starting your schooling, or now since working in the field, that maybe is unique or interesting about your career.
I think having tried a few things in dentistry, one thing that wasn't really emphasized as I was deciding on this career path, or maybe I just wasn't listening, was that you are, unless you sort of make major plans otherwise, going to try to own a practice in order to like be at the pinnacle of your career. I think that's kind of like what your goal is. And coming with that is a lot of management, managing people, hiring, firing, every little office thing. You're basically running like a huge company, like in a small form, like you're everything. That really wasn't, I didn't know that that was going to be so expected of me. And I didn't want to do it. And I had to just figure out a way to not be like, have that not be something I had to do, which ultimately did work out. But I think that was lucky in a way. So I think if you are kind of going into this as a career, you need to know that it's a thing. And it's hard to avoid it being a thing. And I think that really successful dentists enjoy that kind of thing. Managing and owning a practice, dealing with financial stuff, all that. So it's kind of like you have to be really good at being a dentist, and you also have to be really good at business management.
I think one thing that I didn't expect so much, I always knew that dentistry involved medicine, science, and art, but I didn't realize how hard it can be sometimes, varying on the patient. So basically, dentistry every day, you're working upside down in direct vision in a tiny cave that has a very large tongue and a lot of saliva, and a lot of the things we do, we need to have really good isolation. So I will say it is very handsy. You have to like to use your hands and develop that skill, but also appreciate the art form of it, and also being able to talk to patients every day. I think I remember hearing someone say, oh, you don't have to talk to them because you just open their mouths and you just work. That's not true. And that's not why I went into it, but I felt like that was always celebrated for some weird reason. And I like that that's not true, because I actually like the chair side aspect of talking to patients, especially having had worked in a lab where I could have talked to nobody all day if I wanted to. So it's quite isolating. So I really like that chair side patient communication.
Yeah, I think mine is kind of like similar to what Olivia said, is like, I always knew people didn't like the dentist. Like I get that, but I was kind of surprised by like how many patients will be like, I don't like you. Like they'll start the appointment off like that. And you definitely let it roll off your back. You have to have an understanding that it's like an anxiety produced response, but I think it's like it's a rewarding aspect of what we do, but it also can be frustrating because you're just kind of like inundated every day with like, I hate being here. I don't like you. And also like, I don't trust dentists. They're trying to take my money and rip me off, and I don't even need this treatment and whatever. So yeah, some days it can be kind of like frustrating, but you also then have these really rewarding moments where you see a patient over time whose initial response was like that, and you're able to be someone that they build trust with, and it completely changes. And so I think that also can be really, really rewarding. but dentistry is definitely like, it's very people heavy. You really have to like learn how to talk to patients and kind of assess where they're at and kind of meet them there to get the best outcome for them. And yeah, it's definitely a challenge, but it's definitely also one of the more rewarding parts of our jobs.
Well, thank you. And for right now, we're going to move on to the case study, but we should have a little bit of time left at the end for any other questions. And we will begin that. And we'll start with Dr. Gaughan and her first case.
Okay, so I'm not sure everyone here knows what a root canal is, but we'll just go over a basic root canal. So the reasons we do root canals are that, well, every tooth has a nerve inside of it. It's left over from development of the tooth. And then after that, it's just inside the tooth. It's, you can hear in this picture, you can see the root of the tooth going into the jawbone. And then inside the root of the tooth, there's a darker channel. That's where the nerve lives. And that nerve can get diseased, inflamed, it can die, and then can get infected. So when we're treating a tooth by doing a root canal, we're dealing with either an inflamed tooth or an infected tooth. And in this case, this patient has a gigantic infection right here. It's this big dark ball in between these two tooth roots. So this is really quite sizable. This woman was 24. She said, my tooth hurts and it's really swollen, and she was in a lot of pain. This is one of a few times that I have given someone anesthetic and the needle causes pus to shoot across the room. So it was pretty awesome. Then let's see. So we go through, really swollen, really painful. She had a history of anxiety and depression, no allergies to anything. So this is kind of how you write up cases in endo and probably in dentistry in general. So for this tooth, there's a diagnosis, the pulp necrosis, that means the nerve is dead. And then there's a diagnosis of the end of the root. This is an apical abscess. So you might have heard of an abscess. So we're going to do a root canal on this patient, which I gave it a good prognosis, but we'll find out that perhaps that wasn't the case. So we can move to the next slide. This is an x-ray of during treatment. So when we do root canal, we clean out that dark gray channel inside the tooth and put this white filling called gutta percha in there. That takes the place of where the nerve was and ideally prevents any bacteria from getting back into that canal space. So this is during treatment, and that just, describes how we're doing it. So we do a lot of rinsing and cleaning of the canal. And one thing about root canals is that is like extremely repetitive, but also not. It's like this beautiful combination of like this rhythmic, methodical treatment that you're providing, but every tooth is unique. So you notice patterns, but you also have differences. So I find it extremely exciting every day. So this is a really simple one though, except for that giant infection. So there I am trying in the root filling, and then we can move to the next slide. And the final finished root canal is the third picture over. So that's what a root canal looks on a tooth. It's just you have those white lines in the x-ray, which I always think is also a thing of beauty. When you have a nice pretty filling at the end, doesn't necessarily mean that the tooth is perfectly clean or that it will succeed, but it does look attractive to have that final x-ray. I really like it. Lots of exciting things about endo. All right, we can go to the next slide. So that's the finished root canal there. And when we do root canals on infected teeth that have this bone loss around the end of the root, the point of doing the root canal is to get that bone to heal, which it will do if you have a success. And not all root canals succeed. They succeed about 95% of the time. If the tooth has a big infection like this, it might be a little bit less. And that infection can take quite a long time to heal because it's bone that your body is building back. So it is getting maybe smaller, but there's a lot of research that shows that these lateral incisors do fail more often because sometimes these are cysts that don't heal well with just a regular root canal. So I think the next slide is what we did next, which is, yeah, she came back. She was still having drainage. That looks like a different tooth. I don't know why that tooth, I think this might be the pre-op x-ray. Will you move to the next slide?
The next case.
Is it another case? Is it a different case? Okay.
Yeah, that was the last one.
Pardon me. Okay, I did a root canal. I'm thinking of a different person that I did a root canal and then I had to do the thing that I'm going to do on this one. Anyway, let's go forward a little bit. I'm getting confused on my own. Go forward a little bit again. Again. That looks, are we going forward now?
This one is where you do have your imaging.
Yeah, okay. So I think maybe it's a different tooth, maybe it's the same tooth. I don't know. I did a root canal on somebody. It didn't work. We had to do the surgery. So this is just some pictures of the surgery. Everything I do is through a microscope. So when I do root canals, I'm looking through a microscope and making a little hole in the tooth, doing the root canal through that magnification. These are pictures taken during a surgery that's also under magnification. So if you can orient yourself on the top left slide, you can see the tooth, the crown of the tooth, and then the gum. And then, moving to the right slide there, we do an incision along the above the gum line. So when you suture them back, you can't see the incision as well. It heals really nicely, but we raise the gum up to find the area of the bone where we will find the end of the root. And in this case, so much bone had been destroyed that you're actually looking at the end of the root. It's that yellower rounded part inside this cavernous hole in the person's maxilla, which was caused by the destruction of bone. So then in this procedure, which is called an apicoectomy, we trim the end of the root off, and then, which is why it looks flatter there. And then if you move to the next slide, we stain the end of the root to see if there's any fractures or anything, and you can visualize that under the microscope. So that blue dye is dye that we use to see if the tooth has any cracks in it. And it didn't look like that it does. So once we see that it isn't cracked or anything, then we seal the end of the root we prepare it. On the left, there's a little drill going into the end of the root canal. Basically, you're doing an upside down root canal. And then the white stuff is a root filling that we put in for the surgery. And then I think the next slide should just be some sutures. Yeah, and this one we put some gel foam in there because there was so much bone missing that hopefully helps the bone grow back, and then stitch them up. And that's after the procedure. And surgeries heal very well. So in this case, I don't think I have a follow-up x-ray, but she was fine after having that procedure done.
All right, so this is, to the left is a photo of a simulation lab. So basically you're working on a mannequin, and everything kind of mimics what a dental auxiliary would look like. To your right, we have air water syringes, curing light, dental instruments. So this is kind of where you live in the second year of dental school. So second year, you're in class all day, and then you usually do have simulation courses in the daytime. And then after class ends around, say, maybe 5 p.m., you go to the sim lab and then you practice. And we also do have competencies in the simulation lab. So a lot of times we're practicing before our simulation lab exams. And then in third year, to the right is basically the clinic. So this is basically where we see our patients. To the left is actually an endomicroscope in the corner. And then at least at BU, we had CERIC, which is a digital scanner. So that's kind of fun because I feel like a lot of dentistry is sort of transitioning to some dental versus taking analog impressions, which is basically if anyone had braces, that's when they take an impression of your mouth with some gooey material and make models of your teeth. So now some schools are training students to do that digitally now, which has been really fun. And clinic is where you live third and fourth year. So no one really tells you about how much lab work you have to do. So that was really fun, but also it's a lot of work, especially after a day of classes, studying, and seeing patients. To the left, an example of setting teeth for a complete upper denture and a lower partial denture. The thing that's kind of the metal thing the casts are mounted on is called an articulator. So this is what mimics a person's mouth in space. And then there's wax instruments, which is really fun if you like to work with wax. It's a lot of carving and molding and basically just kind of practicing an eye for aesthetics. Once you kind of practice that, you kind of appreciate how much work goes into dentures and teeth. On the upper with the green model with the two little metal custom abutments, so those mimic implants. So this patient, they had endo done, and months later it failed and they had lost a lot of bone and it lost the tooth along with it. So this patient decided to have 2 implants done. The metal piece that you see here mimic a crown prep. These are called tie custom abutments. And then on top to the right, you can see that the 2 crowns fit really nicely on top. And yeah, there's a lot of lab work entailed in your 3rd and 4th year after you see your patients. It's a great way to appreciate how much goes into removable prosthesis. A lot of dentists in practice, they actually send a lot of their lab work out. So this is just a way for students to learn what goes in it and how to troubleshoot. Sometimes that entails taking your lab work home. And then in the picture on the bottom right corner is an example of Sarah CAD CAM. So instead of taking an impression like I did for the green models above, this is a digital impression. So you get to scan the tooth that you had prepped. Prepping means just shaving the tooth down so that it can retain a crown on top. And then designing the crown digitally and then milling that with whatever material you decide to choose. There's a lot of different types of ceramics out there. And so you're just designing it on this software and then you mill it. And so there's a machine that mills all these crowns from a block. And then you take that block and bring it to the lab tech, they stain it, they bake it some more, and then it's for crown delivery. So the perks to digital dentistry is someone can go in and have a same day crown delivered versus the old traditional way. You would have to send the impressions out to a lab and reschedule the patient 3 weeks later to deliver the crown. Both in residency, we practice mostly the traditional way, and a lot of dentists in Vermont actually still do. But some private practices also do a lot of digital steric dentistry. So this is basically an example of bite wing x-rays. A lot of you may go to the dentist, get your cleaning done, take some bite wing x-rays, and this is what they look like. It's mostly taking pictures of your posterior teeth, which are your back teeth on your right and your left side. This patient is a young 19-year-old male. The top row of bite wings was taken in 2018. As you can see, he has all his teeth, everything looks good. But then fast forward to 2020, you can see that he has a lot of cavities. How to identify a cavity on an x-ray? If you look in between the teeth, so as you see the tooth has 3 layers. You have the enamel layer, which is that nice white opaque layer outside of the tooth. The second layer is dentin. And then the third layer is that channel, which is your pulp. So whenever you see a dark shadow in the white enamel layer, and then once you start to see it enter into the dentin layer, that indicates a cavity. And that also indicates to treat that tooth with a filling. So as you can kind of see, if you look in between the teeth, little dark shadows, even where the mouse is right now on that picture, actually a little to the left. Yeah, it's okay. But basically that really dark shadow, that's actually a large cavity in front of the tooth. So yeah, this is an example of bite wings x-rays that we'll look at during periodic exams. And that's your basically regular 6-month checkup. So this is the same patient. This is a panoramic x-ray. So basically this x-ray encompasses your whole entire mouth. It's kind of imagining taking a picture of somebody and then kind of taking that paper and folding it flat on the table. And that's kind of what this looks like. And as you can see, their wisdom teeth are the small teeth in the corner of each quadrant. And yeah, this is just an example of a great pano that I wanted to show. We usually take those photos in their teenage years to see if they need orthodontic treatment or wisdom teeth extractions.
Olivia, I can take the next couple slides if you want me to.
Okay.
So this is an example of a filling, a really nice, beautiful filling. I don't know who did this, but it's gorgeous. But anyway, so there's basically like 2 main types of restorations we do. There's direct restorations, which are fillings. So if you have a cavity, we remove the cavity with a drill. We clean out the cavity, all the soft. When a tooth decays, it gets softer. Enamel is the hardest substance, hardest tissue in the body. And so when that starts to demineralize and break down, it becomes soft. And so that's what, like when someone says, oh, I got a filling, that's what we're doing. We're drilling, we're accessing the decay underneath the enamel and then cleaning it out. And then we're placing, we have a few different materials. There's a lot of material science in dentistry. That's the other thing I didn't know going into dentistry. But so this looks like they place a composite restoration, which is a white filling. This is a great picture though, because you see amalgam fillings in the 2 adjacent teeth, which are those silver fillings. That's an older material. It's not used as often anymore. It's actually a great restorative material and that it lasts decades. And so, yeah, that's what a filling looks like. I don't know exactly this case, but we already kind of covered root canals. So it looks like they did a big, I'm just going to guess here what happened, but it looks like they did a big composite restoration. And then what happens sometimes when we do really big composite restorations, the restoration might break down. It might take part of the tooth with it. And so when that happens, if the nerve of the tooth is affected, like Dr. Gaughan was saying, either exposed to the oral environment or decay reaches the nerve of the tooth, then the patient will need a root canal. And so Dr. Gaughan did a really great explanation, but that's showing some more images of root canals, which is another part of our practice. And then this is a really awesome case that we've all kind of had a hand in our residency. So this will kind of showcase what we call fixed prosthodontics, which is the placement of crowns. Crowns are like caps, they're like a lid on a box. We basically take away tooth structure 360 degrees around the tooth so that we can then slide a cap over the tooth. This is done when there's a lot of missing tooth structure that needs to be reinforced with a 360 degree restoration. And in this case, the patient had a few different problems going on. He's lost a lot of tooth structure. It could be due to decay, like cavities, but also in his case could due to some sort of parafunctional habit, like clenching and grinding. That's why a lot of his teeth look broken down or kind of like broken or fractured. And so he's also lost some height to his bite, basically. He's lost some tooth support. And so his facial features are a little bit collapsed because he's lost the support of his teeth. So what we did in this case, it's kind of complicated. I won't bore you guys too much, but we established that height back with using this clear splint that you see in the first picture. That's important to do when you're doing big cases like this because the position of the jaws isn't just tooth driven. It's also driven by the muscles and also the TMJ, the temporomandibular joint. So if you're gonna increase the height in someone's teeth, you also have to make sure that their muscles and their joint are gonna be happy with that new position. So we made that splint and then we essentially built the teeth up with composite material, like the material that we showed you in the last couple slides, to kind of establish what that new height is without having to have the splint in place. And then in that third picture on the top row, you see that we've now prepared the teeth, as I was talking about, a full 360 degrees around the tooth. And then the fourth picture, he's in temporary crowns, which aren't as aesthetic, but they hold the positioning and they protect the teeth that we've now prepared, because we have to take the impression, like Olivia was saying, we're doing it the old school way. We sent the impression out to the lab, and the lab fabricated his permanent crowns, which you can see cemented in the last picture. This case isn't completely done yet. We're also going to do a similar thing for the bottom teeth so that he has brand new crowns on all the teeth. But it's completely changed his smile, and not only his smile, I think there might be another picture. Yeah, so it completely changed his smile, but you can also see that it's, and this isn't a great picture because you can't see his whole face, but it also changes the facial aesthetics, like I was talking about, by giving him that height back. It opens up his muscles more. He doesn't look as collapsed. His lips even look a little bit fuller on the top. So it's a really nice service we can do for patients. And then this last patient was a young person with essentially terminal dentition, teeth that we really couldn't through any way. They're so affected by cavities that we couldn't predictably build them back up. So yeah, you can go to the next slide. This is the Panorex. Again, you can see a lot of broken, fractured teeth, those dark shadows. So there wasn't really enough for us to strategically keep or to restore. So in this case, we did a full denture for the patient. So we removed his natural dentition and we replaced it with a denture, which is a removable solution. So it's not cemented in place. The patient can take it in and out. But again, it really transforms their smile. And then lastly, this is more of the stuff that we deal with in the hospital. These are examples of really advanced dental infections. And you know, when people don't have access or can't get to the dentist, a lot of times they'll ignore signs and symptoms of infection, and it can be very dangerous. It can progress very fast from the bone. It can expand into the soft tissues, which these are all examples of soft tissue abscesses. And it can cause really dangerous inflammation in the surrounding tissues of the head and neck, which can also challenge the airway. So these types of infections can become life-threatening. And so these are kind of the things we see in the hospital, and we work with our oral surgery team and also our ENT colleagues, and we have to drain these a lot of times surgically in the OR.
Well, thank you so much.
Thank you for sharing those cases. Yep, and just a little bit about what you do. We do have a question from the chat asking, do you have any suggestions for activities or ways to get high school students to think about a career in oral health? Maybe something fun to do with dental tools, or would allow them to try like manual dentistry?
I would kind of say the easiest way to kind of be exposed to dentistry is to reach out to your local dentist and see if you can shadow. I think that's a great way to get some exposure in learning how, the day in the life of a dentist is and what kind of auxiliary staff there are to help support dentists and ways to kind of enter the field. Dexterity wise, I'm not sure. I mean, I would say maybe Dr. Gaughan can elaborate more on getting more into art and using more hand skills, but
I definitely think that one of the things that was most helpful was ceramics, really. Like it's a lot of carving. Like when you're in dental school, it's like a lot of molding of materials. Like Grace mentioned, all the different materials we use. they all have a different feel, and you have to have like a really great tactile sensibility to be able to work with a lot of them. So I would say the more you can use your hands to feel different types of materials and use them in like really small environments. So to me, ceramics comes to mind. And the other thing, like, you really can't do any drilling. Like they don't, like the dental tools that we use are just so highly specialized. There's just no way that a high school student's going to be able to like have any of those probably, but you could like look at a skull or look at like some, it's called a typodont. So I think in some of the pictures you saw the fake mouths, they could look at that, but I don't think you could really like do anything with it other than examine it sort of and understand the anatomy of the mouth or the skull. So yeah, like maybe one of the plastic skulls that we use, like to just start understanding some of the anatomy might be kind of fun also, because that's really abstract too. Like, because you see a face and it's hard to imagine that it's all like hard tissue under it that, you know, we end up drilling on. So maybe something like that.
Thank you. And then I had another question about just the field of dentistry and the different avenues you could go down. What is it like to become a pediatric dentist, or the type of oral surgeon who takes wisdom teeth out? Are they different residencies that you can do, and what kind of options are there for dental students?
Yeah, so there's a whole slew of specialties. There's pediatric dentistry, there's endodontics, which Dr. Gaughan practices. There's periodontics, which is like a gum specialist. So they do a lot of soft tissue surgery in the mouth. And then there's oral surgeons. And then there's other ones like public health dentists. There's dental anesthesiology, which is a newer field. So yeah, there's a lot of different options. I don't know how many like ADA recognized specialties there are. And the residencies all vary. So for general practice, like what me and Olivia are doing, there's an optional 1-year residency. The other options go to straight into practice. And then for all the other specialties, there's varying years of specialty between 2 years and 6 years. So the 6-year program is an oral surgery program. Oral surgeons are, if they do a 6-year program, they're dual degreed with an MD and their DMD or DDS. And then they also do like the surgical residency piece. So they train in hospital settings. And then the other dental specialties are mostly clinic-based, where you're really focusing on your specialty procedures. But again, those all really vary in years and length.
Well, thank you. And we like to finish up our sessions asking all of our panelists a final question, which is what your favorite part about practicing in Vermont or working with the Vermont community is.
So I think not being from Vermont, but moving here from like a bigger city where it's like lots of amenities and lots of access to anything you could need. Vermont, if you've tried to make like a medical appointment here, it can be very challenging. So it's definitely, you feel like you're in a place where you're needed and patients really appreciate you generally. I think even patients who might be dreading it or really nervous, almost everybody is really appreciative and has a good experience. Like, I think they're just happy that they have the ability to get the kind of care that we provide. So I think feeling appreciated and like feeling like we are in a place where people can really use your services is nice.
Yeah, for me, I'm a Vermonter. I grew up in Vermont, and it's just really special for me. I feel like when you grow up here, there's such a feeling of community, and like there's a really large emphasis on community in the state. And so it's nice to just be practicing in a place that I feel like gave me, you know, a lot of opportunity and a lot of support. And so I'm just really grateful to be able to give back to my community. And then with that said, I also think a really nice and awesome part about practicing in Vermont is the community of dentists themselves that choose to live and work here in a place where there is an underserved population. They're all just really awesome individuals who are also really like champions of our profession and are just like really outstanding professionals, and they really want to help young dentists establish here because they really care so much about the profession and the community they serve. And I think that's like one of the major benefits of working here as a dentist. And you meet people like Dr. Gaughan who want to be part of our residency just to help us and see us grow. And it's just like a really awesome place to be.
Yeah, I mean, I really can't add that much more than what Grace had mentioned. I have a lot of the same thoughts. I think coming to pursue at least dentistry and my residency here in Vermont, it's been really gratifying and rewarding knowing that I'm improving and learning more clinical skills, serving people who are in need, and knowing that they are really welcoming to people outside of Vermont, which I find has been really welcoming, even though I lived here a long time ago. And then coming back, it's been kind of a fun homecoming, coming back here and learning as a provider. And like Grace mentioned, the community of dentists here, they're really supportive, and we have a lot of staff in the residency program that volunteer their time out of their own busy schedules to not only mentor us in clinic, but also lecture us every Tuesday. And every Tuesday night it's called Tuesday night lectures, where we meet with different dentists in the community from all different specialties who give us a lecture after they've worked a full day in clinic. So that's been really awesome, being able to network and learn from them and see where they came from and why they landed in Vermont. And I feel like everyone has the same opinion of how great it is to work here.
Well, thank you all so much for being here with us tonight. We really appreciate it and are excited to share with students on the YouTube channel as well about what it is like to be a dentist. And then next month, our session is going to be on entry-level positions in healthcare, which is really great to learn about if you want to go to dentistry school, medical school, PA school, nurse practitioner school, anything where you want to move forward and actually have hands-on experience. So we're going to have a variety of different people that work at different entry-level positions. So we will see you all next month on March 16th.
And thank you everyone for joining us tonight, and we look forward to seeing you next month. Take care, everyone.